Best practices for managing food allergy really rely on education and avoidance. You obviously want to know what you or your child is allergic to and how best to avoid that allergen. But also very important in managing food allergies involves knowing how and when to treat an allergic reaction. And the how is often easier than the when. The how is you administer epinephrine, you get Benadryl, etc. But parents often ask, well, when do I do it? Like, how do I know that I need to be giving epinephrine or giving medication? And I tell them that if you know your child ate something, or you strongly suspect that your child ate something, and you notice they have hives, or they're coughing, or they're sneezing, obviously abdominal pain, vomiting, then you want to administer the epinephrine auto-injector immediately. If you're not sure if your child ate something, they have a hive, otherwise they're acting well, you may elect to give Benadryl.
And then there are two main forms of testing. The first is skin testing. We would usually test to the food we are concerned they reacted to, or maybe some cross-reactive foods, or immunocap, which is blood-based or serum-specific IgE. That's another way to test for food allergies.
So we're often asked, how can I keep my child safe when they're in school or during school hours? And the best way to do that really is to make sure that everybody is on the same page. You want to talk to your child, you want to make sure they know what they're allergic to and how to avoid it. But equally as important, you want to talk to the child's teacher, get the school nurse involved, and even sometimes the principal will become part of the process.
And then helping when there's certain situations that perhaps the parents don't have control over, such as when there are parties or birthday parties or Halloween parties, or even when the kids go on field trips, who's going to be watching out for their child and their food allergy concerns.
A little hint that I give my patients is you can always pack a wipe in their lunchbox and have them just wipe the surface of the table before they sit down, and then they know that their area where they're going to be enjoying their lunch is allergen free.